talk to your kid. Don't sit down at the dining room table and say, now we're going to have a talk.
Youth that do gamble are 6 times more likely to develop an addiction as an adult.
You have this certain mentality, never my kid.
They shouldn't feel isolated for making a healthy choice.
For a safe, healthy, and drug-free community.
Watch Step Up to Save Our Children today.
Hi, everyone, and welcome to Step Up to Save Our Children. This podcast is where we take a closer look at the issues that are shaping the lives of our youth. I'm your host, Denise Mayer, and in this episode, we're talking about a trend that's lighting up schools, sparking health concerns, and raising tough questions. Teen vaping, and the saga continues. You may have heard the stories or experienced them firsthand. Teens as young as 12 are using vape pens in school bathrooms. Sweet, fruity flavors masking powerful nicotine, and products that are not only addictive, but clearly marked to appeal to younger audiences. The good news is that there is evidence that awareness is having a positive impact. So whether you're a teacher trying to keep your classroom safe or a parent navigating tough conversations at home, this is a conversation you won't want to miss. So stick around because it's time to clear the air. My guest today is Dr. Amy Van Milligan, who received her medical degree from Virginia Commonwealth University in 2001. Then she moved to Cincinnati, Ohio for her residency training and for her, in her words, amazing ice cream. She completed a dual residency in internal medicine and pediatrics in 2005. She worked at various federally qualified health centers for about 15 years before focusing on addiction medicine. Dr. Van Milligan joined Greater Cincinnati Behavioral Health Services in 2022 at their Batavia locations. She is passionate about providing comprehensive, compassionate health care to those affected by substance use disorders. Amy, I can't thank you enough for being on, and I'm just going to call you Amy and not Dr. Van Milligan because that's a mouthful.
It is definitely
but I
a
like
mouthful.
it. It's very, very nice sounding. Yes.
Well, thanks so much for having me. My pleasure.
Today I'm so happy to have you. So we started our coalition, Step Up to Save Our Children. Step Up just Anderson Township in 2018 because of vaping. I had no idea what it was as a grandmother, never heard of it, and was flabbergasted at what was available to the kids and what could do to them. So that's why we started our coalition. But we've evolved on fentanyl poisoning and a lot on marijuana and mental health issues, you name it. And we really haven't gotten back to vaping again. And as my good friend, Dr. Weiner says, it keeps going and changing and the whole culture changes. So how did you get involved in this particular kind of thing with the vaping and all the other things?
Well, I would say I had early experience in my career regarding nicotine. So my very first job out of residency was in Ripley, Ohio. So a tiny little town on the Ohio River with a long, long history of tobacco heritage. So many of the patients I was seeing there were from tobacco farming families. I met one patient who I was seeing him at about the age of 55, 56 for his lung disease, and he reported he had been smoking for 50 years. He actually started rolling tobacco cigarettes with his grandma on the front porch prior to going to kindergarten. And I remember thinking, oh my goodness.
My gosh.
And it's really hard when there's been that much history to have some, good discussions and good dialogues about sort of the health risks. We also would sometimes see teenagers who suffered from, it's called green tobacco syndrome or nicotine poisoning. It's when especially young people without much tolerance to nicotine go out and strip tobacco with their families, and they often will develop nausea and vomiting and headaches and dizziness. It looks almost like heat stroke. And sometimes that might be accompanying it. And I remember just thinking, we need to do something about tobacco and about, nicotine's, influence on people and its health effects.
Well, isn't nicotine, I've read this many times, is like the number one addictive substance out
Yes.
there. And many
Yes.
times they'll say it's way worse than heroin. So when you
Yes.
see, I used to look at smokers with a bit of disdain, like, what's wrong with you? Why don't you quit doing that? It's terrible for you. And now it's more empathy and sympathy that they can't get off of it and what it's done to
Yes.
them.
Yeah.
And so
Data
now we have this
shows.
next whole yeah.
Yeah. Data shows that 40% of people who start smoking are unable to ever quit over the span of their lifetime. And we see lots of clients, at our treatment centers who have given up fentanyl and given up cocaine and given up methamphetamine, but the cigarettes and the nicotine are still a big struggle.
And you just think about, this, we are now, we fought this for so long. I mean, I'm very old, and I remember all the campaigns to stop, the smoking and to make sure that the kids didn't start picking those up, because that was the first thing. Even my own kids who are in their 50s, they did the same thing. I tried a cigarette, that's the way they do. But luckily it didn't stick. The point is that now we are starting with this next whole generation that were not aware of the tobacco part, like I was, and probably you were too. And now we're heading into another whole thing with way worse nicotine than even a regular cigarette.
Yes. Yes. It's much, much
It's
stronger.
frightening.
It's completely frightening, and we do not have the same rules or limits of other countries. I think the limit for nicotine and vapes here is 3 times as high as other countries, and that's really concerning. And then, of course, so few of our products are in any way regulated by the FDA, so we know that many people are getting even more than what is allowed at our high limit. And I just was, listening to a podcast about how just in 2 or 3 years time span, the concentration of nicotine went up dramatically, and then the sort of amount of puffs in some of these products went up dramatically, while costs went down 70%. And for young people, $10.
I was listening to that.
Yeah. Yeah. A $10 pack of cigarettes is very often sort of, outside of their financial resources. But if you can get a $20 disposable vape pen, which may be equal to 20 packs of cigarettes, sometimes
100 packs.
100 packs. I mean, that's huge. That provides a lot of exposure to these chemicals.
Absolutely. And it also is a thing then that they can pass them around, like somebody takes a hit and then here, you can take a couple hits off of this or whatever, which of course is wonderful for any kind of infection, strep or mono or anything else. But
Yes.
on top of everything else that they're doing, it's like, it's amazing. But what I was reading is that the main reason that they're attracted to it to start with, of course, are the flavors. And in places where they've been able to remove those, the incidents have gone down. We are not there yet, obviously. That happened, I think, with Juul. But let's actually just talk about what vaping is before we get into all that. What you want to take that? What
Sure.
things? What's involved with that?
So, vaping or e-cigarettes involves battery-operated devices that heat a liquid that typically contains nicotine. Sometimes it may contain THC. It heats it to a significantly high temperature, but lower than combustion, lower than lighting a cigarette on fire. And then the device produces an aerosol that passes through a filter and people take a breath in. Although we call it vaping really is more, that terminology more is related to like water vapor. And there's actually no water contained in these devices. I think a lot of people think, oh, it's just, some water and some nicotine and maybe a preservative or two. And that is not at all the case. That, most of these devices
No.
are producing aerosolized smoke, if you will, containing 1,000 to 2,000 different chemicals. We know some of the bad players in this chemical lineup, but a lot are really undiscovered or unstudied. And so we're sort of left to wonder about the harmful effects, and certainly no studies on what does this whole conglomeration do to somebody's health.
Right. And one of the metal, but not metals, but one of the substances, I guess, is formaldehyde. And that
Yeah.
one just is amazing to me because that's what is used in preserving bodies when they're, in a post-mortem sort of situation. And now these kids, they have no idea what the heck they're putting in their body or sucking that into their lungs. And, when this first started, I just was so amazed at some of the adults that were doing it and not concerned particularly with just what you just said, all the things that you kind of know, most of the bad things in tobacco. Not that that's a good thing, it's not at all. But in this, because they think it's, like you said, water vapor, they think it's safe, and parents think it's an okay thing, and it's totally not. And then when they start having symptoms, well, we'll get into all the medical stuff that they have, but they also have the psychological and mental stuff that goes along with it that is so scary. So I really worry about when they said when there's flavors and they say cool on them anywhere at all, it's usually a mint kind of thing, and the kids go for that because it's a smoother inhale than, like,
Right.
you smoke a cigarette. I never really did, but if you smoked a cigarette, I mean, they say there's a burning to the cigarette, but with what these kids are picking, that's really not what they're getting. So they like the watermelon or the, whatever it is, and it tastes good. And then they get a little bit of a buzz from it initially, and then they get lots of bad things that come along with it. So, what have you seen? Like, do you, I know you're on the Claremont Drug Free Coalition because that's how I
Yes.
know you.
Yeah.
But yeah, so what kinds of things do you see even in, I know we're focusing right now on the teenagers, but like you said about the man that you were dealing with that did about the tobacco, sitting on his grandmother's front porch rolling a cigarette. The teens can sometimes look to the adults and say, oh, well, she's doing it. I mean, if she's doing it, then it can't be that bad. She's an adult, whatever. But I was at a party Friday night that he had a party upstairs, and then you went downstairs to use the restrooms, and there was a bar down there. And I was talking to this lady, and she must have taken 4 or 5 puffs off of one of her devices, and it was nicotine. I couldn't believe it. I mean, this woman's in her 50s.
Right.
So do you see a lot of that?
Yeah, we definitely see a lot of vaping. So I would say there have been 2 circumstances in the last few weeks that have made an impact on, sort of how I think about vaping. So the first involves a dear friend of mine. Her daughter's in high school, a really wonderful young woman. She volunteers at the Senior Citizen Center, is involved in drama and different, school activities. And they had called me up because her daughter was feeling sick. It was the week of prom, and she was coughing and congested and had a hoarse voice and just didn't feel well. So the mom was keeping her at home and, wanted my insight on, anything else they should try. So I recommended honey for the cough. I recommended maybe some Zyrtec or Claritin in case part of it was due to the weather changes. Well, unfortunately, I got a call a few days later that they had found out that their daughter had been vaping over the last couple of weeks. And she was sick and miserable and short of breath and was unable to, attend her dance events that weekend because she was still feeling ill. And I think it's one of those things that as parents, you want to know what's going on. But the hard part is that very often, because these devices are so discreet and easy to hide, and you may have kind of a sicky sweet smell that's present right after vaping, it pretty quickly dissipates. It doesn't stick to people's hair and clothes quite the same way as cigarettes do. And of course, for young women, sometimes they can cover things up with some, body spray or perfume or other things. But my heart just kind of broke, because here was a family looking forward to these, big events, and she wasn't able to participate. And it was, completely preventable. But
well, there is good news to that one, because she hadn't been doing it that long.
yes.
So there might not have been any permanent damage. But I met a mother of a teenager that had gone undetected because she didn't, I guess, develop the asthma type of, issues with it, and just could not kick it. She was in and out of Children's Hospital, and probably, I haven't followed up, possibly a lung transplant. And I mean, that's when it goes that far that there's no coming back without, like I said, a transplant or something.
Right.
So I think parents, they don't know what this is. That's what my whole thing about bringing this awareness is, that, you hear about, you see the vape shops. We live in Anderson, up and down now, are nothing but vape shops, I swear. And it seems like there's a new one all the time. Plus they sell them in the easy convenience stores sometimes and things like that. So they're pretty darn easy to get their hands on. And of course they can get it, mail order type of thing, online. But what I read is that is the number one way that they get the vapes, teenagers, is from each other and older siblings, older friends, things like that, who are 21 and can go buy this stuff. Plus, we know out here in Anderson, and in Claremont too, there is at least one group of vape shops that will sell to underage kids.
Absolutely.
And they keep getting caught, but there's not enough teeth in the law for it. So, but let's talk a little bit more about,
Yeah, it just feels like a slap on the wrist.
Exactly. Oh, and they're going after some teenage clerk that is selling this stuff, where you need to go after the owner, and eventually that happens. But I don't know that it happens, like you said, with any real smackdown or whatever. I don't know. But we'll get to some of the things that parents can do, and it's not a lot, but it's certainly something. But let's talk a little bit about we talked a little bit about the flavored vapes, and the disposable vapes and how high they are in nicotine. But there's something new, vape. It's called an Elf bar, and it's a little bit bigger and holds a lot, I think. And a lot of the kids are using those. But let's talk a little bit about these pouches. Do you want, about those?
Yes.
So let's hear about those. I just heard about those.
So I think for many of us, we think of the pouches, most famous of which is Zyn, ZYN pouches, as kind of the new take on chewing tobacco. So vapes and e-cigarettes are kind of the new take on cigarettes. And then Zyn pouches are the new take, if you will, on chewing tobacco. So these are very, very concentrated nicotine pouches that you usually place between your gum and your teeth. They also come in a wide variety of flavors, really popular. There's lots of what they call Zinfluencers. So these are people in Instagram and other social media platforms who are really pushing Zen as a sort of quick energy pick-me-up, and that it's, beautiful and cool and there's nothing dirty or dreaded about it. We're starting to see a lot of concerns from the dental health world with regards to oral, sores and ulcers that aren't healing well, because this is way too concentrated to be held in your mouth for, 10 or 15 minutes. So we're starting to see concerns there. We suspect that because of the degree of inflammation it can cause to those tissues, that Eventually, there'll be a link to different types of oral and throat cancers. Of course, that is a little bit too early for now. I think for many of us, one of the concerns is given the amount of nicotine in that product. And in some ways, I would argue it's even less noticeable for parents or teachers than even the e-cigarettes. One of the concerns is this may be something that gets that child or young adult hooked on nicotine and susceptible to other substance use disorders down the road.
Absolutely. And we both know that to be the fact that, the nicotine can be a gateway. It often is a gateway. Start with that. They're vaping the nicotine. They start vaping the THC, and we could go on. That's another whole podcast. But yeah, that they, go down that rabbit hole. And, but, getting back to just the pouches themselves and how you equated them to chewing tobacco, and did they call that dip or something, where they would take a little bit and they'd stick it down in there and then they'd hold it like this and then they keep spitting. And honestly, I had an experience with that with a friend's son. He was riding in my car and he had to keep spitting into this jar. I thought, you have got to be kidding me. This is disgusting. But these are not as disgusting. See, so they can get away with it more. Yeah. My granddaughter that's a junior in, well, she just finished her junior year in college. I mentioned it to her about the pouch. She says, oh, yeah. Oh, yeah. Those are a big deal now. That's a big deal. Because like you said, you don't really know that they're doing it.
Right.
Yeah.
Right. And I think they're sometimes also used by students who want, a little burst of energy, maybe help with studying, things like that. But there's lots of concerns for all of these new things. It just seems like the big tobacco companies want to dress up nicotine in any way, shape, or form and try to make as much money off the backs of our teens and young adults as possible, and hopefully gain lifetime customers, because if they can get them when they're young, then they know that they'll use down the road.
100%. And I'm in full agreement. And I think that that's the thing that has gotten to me more than anything, is that big tobacco, Philip Morris, they're the ones making those pouches. They've even, they've got a big new plant in Colorado and one somewhere else where they can't turn these things out fast enough. And, their audience for the regular tobacco, was limited somewhat, went down because of all the advertising and all the education that went with it. So now they decided that they're going to go after our children. And that just angers me beyond belief that we're allowing, as parents, grandparents, we're allowing this to happen. And the same commercials, the same ads, Joe Marlboro, all that, the Camel, Joe Camel and all that. They're the exact same ads, but updated a little bit with a little bit more trendy clothes on or whatever. But it's the same marketing that they did in the 60s. It's just amazing to me.
Right.
Yeah.
Right. It all feels like history's, repeating itself. And then I think, we have concerns in our country also about safety of products, and we really don't know about the safety of these things. And a few weeks ago, I saw an adult client who had a significant, probably dollar-sized, second-degree blistering burn on the roof of his mouth. He had gone to take it was terrible looking. He had gone to take a puff at his vape, and it exploded the hot liquid to the roof of his mouth, to the point he ended up in the emergency room for pain control. And we were having to use scheduled Tylenol, scheduled ibuprofen, scheduled numbing mouthwash, along with a soft diet for 5 to 7 days just to get him some relief. And he said every time he swallowed something, it felt like it was pushing through a membrane. So I suspect if he had had a scope, I would suspect he would have seen some of those ulcerations down his esophagus as well. But, these products are...
anytime you burn your mouth, like hot soup or hot coffee or something, if that really burns it and it can last for I can't even imagine this.
No,
that absolutely makes me ill thinking that.
Terrible. And in many ways, he was lucky, because when I was researching for this podcast, I found a scientific study about 46 patients who presented to a hospital in Germany with burn injuries, all related to vape products or e-cigarettes. And in the study of 46 patients, 60% of those burns involved the groin, about 25% involved the hands. They blew up in people's hands, and then about another 20% involved sort of mouth, face. And in that study, 60% of those patients needed skin grafting. Which is just terrifying to think about the danger and risk. And it was interesting when I saw my client, I was treating him for his mouth burn. He related to me that one of his friends had a perfect rectangular size burn on his thigh from when one of these had exploded in his pocket.
In his pants.
Yeah. And
I've read about that.
That can happen. They have lithium ion batteries, and very often if the batteries get loose and then knock against keys or knock against coins, that can cause an explosion. And so when I was talking to my client about, hey, this terrible thing happened, are you going to continue vaping? And he said, I'd really like to tell you this will make me quit, but I'm actually not sure. I might still go back to it. And I remember
because he's so addicted. Yeah.
Just
So
sad
addicted.
and flabbergasted in some ways, because he, in some ways.
Yeah. I've seen cars blow up, where the thing got loose in the car and the whole car blew up.
Yes.
Oh my God.
Yes, I read a whole list of safety tips in terms of not charging these devices with your phone charger or tablet charger. Sometimes they will blow up because it's a different strength of charging signal. To always replace the batteries if they get wet, but people are constantly washing these in the washing machine, that you should never charge it overnight unattended in case a fire happens while you are asleep, that you shouldn't leave it in a hot car, certainly shouldn't take it on a plane with you, and then to never carry it in your pockets because of the concern for a burn in that area.
And the ironic thing about this is, and this is a good thing, this generation, our young people, are very concerned with the environment. They are concerned about a lot of the things that, we've done or, continue to do, whatever. But nobody thinks about all of the trash that is coming from these vapes. And I know we did a drug take back thing a while ago, and I had a setup for people to bring their vapes. I think I got one. I mean, it was like nobody's giving those up. And then when they're done with them, they throw them away. And it's causing all kinds of trash and things like that, which if they really understood that, I think they would be thinking. But see, once you're so addicted, like you said, with that burn, it really doesn't make that much difference. You're just going to keep doing it. And quitting is so hard. And that is one of the, and we'll get into that, but one of the things that I really want parents to understand that have young kids, particularly like 6th, 7th, 8th, 9th grade kids that are just experimenting and, maybe doing a little here and then they get very, very addicted to it, that they're setting them up they're setting themselves up, but they don't understand. So it's a continual thing that is going to go on, and they're going to be, like you said earlier, customers for life. But who knows? I mean, there's so much mental stuff, and we can talk about that too, that goes into this, not just the physical, but the physical's enough. I mean, I think I read too, I think it was on Dr. Weiner's webinar that he did for Operation Parent. And if anybody's listening, Operation Parent's amazing. They have great webinars. And they were saying that they found that it mutates the DNA. With these vapes. And so, down the road, if you do that enough, I'm not going to get into medical terms, not that I know that many, but I know a few, then you end up possibly with cancer, so that, boy, that's a great end up thing is, that now the child down the road, maybe in their 30s, he has cancer and wondering why. And that's one of the factors.
Yep.
I don't know.
We do have some good mouse studies out already showing that exposure to the aerosols from vapes can cause tumors to form in the mice and for sort of cancers to spread in the mice. So I think we will get human data down the road, but I would really prefer not to prove that fact and try to stop it, before we have,
Right.
cancer forming in our young people.
Right. Well, and when you see a car of kids and it looks like, I mean, if somebody would smoke a cigarette, there might be a little bit of smoke and, they let it out the window. It's like the whole car is just completely full of this vapor. And again, it's not water vapor. And it's got all these chemicals and heavy metals and things we don't even know what's in there. And even if the 2 of the 4 are doing this, even 1, and the rest of them are just in there with the windows up, it's winter. It's all that secondhand that they're getting.
Yeah,
definitely. I don't think people think about that.
No, I don't think so either.
Yeah.
And I think a lot of people are more inclined to vape around their kids compared to cigarettes. Even, some parents that I think typically go outside, smoke outside, try to wear a, different coat outside if they're smoking. I think, a lot of those parents don't see the harm in necessarily vaping in front of them because the smell isn't as bad, more fruity and chemical rather than the smoky smell of cigarette.
It smells like mom's doing the laundry, and it smells like the laundry conditioner or whatever. And I'm just amazed at schools, particularly that, and you and I both know that, how much they are fighting it, been fighting it, still fighting it. The good news is, like you said earlier, I think it's down a little bit. So, we love to celebrate that the awareness that we've all been working so hard on is actually making an impact, but it's really hard to know. And again, I like to say this over and over again is the majority of the kids aren't doing this. Correct. The majority of our kids, I know some of my grandchildren, they'll say, well, I won't even go in the bathroom because, it stinks in there and whatever. And the poor teachers, they've tried to do, the alarms and all of the things but they're catching them. They're not preventing anything. And then, then you're suspended for 2 weeks or you're suspended. Well, what's that? That's go home and do it some more. We're not really getting to the problem. And I don't think parents that really, by the time parents often know there's a serious problem, it is serious. And then the child can't get off of it and they're having such a hard time. And then it translates, I believe, into behavioral issues. And, so we really need to talk about some of the mental health things that go along with it. I know for one thing, and you can elaborate, anxiety, so high.
Yes. So we know that nicotine affects both dopamine. So that's the brain chemical that's most involved in rewards. And so having a vape, using a vape, kind of gives you a similar high to, my clients who unfortunately have struggled with meth or cocaine, or people who struggle with gambling or other addictive behaviors. So there's that piece of things, but the nicotine also works on this serotonin system. So the serotonin system is involved in mood regulation. Very often we use medicines like Prozac or Zoloft, which help boost the serotonin level. And one of the challenges with nicotine is that it really affects that system's health. And so individuals who use nicotine are more prone to anxiety, more prone to depression. It's harder to treat anxiety and depression in those individuals because they're continuing to use a substance that's affecting that area. And then, as you said, the concern for the dopamine is that the dopamine rush, sometimes from substances, whether it's nicotine or alcohol or other drugs, can be so big, such a big burst to our brains that then folks start to lose interest in other activities, riding a bike, playing sports, hanging out with friends. That very often, then the challenge is our brain is seeking out some of those things. And that becomes, much more challenging, I think, for some of the normal everyday joys to kind of take the place. So very often for teenagers and adolescents, one of the first signs that they may be using a substance is kind of isolating themselves and not doing the things they used to enjoy doing, whether that was sports or friends activities or things like that.
Right. And the thing is with that, with parents trying to like keep their eyes open about all this and knowing what's going on, now they're dealing with a 7th, 8th, 9th grade child that is dealing with hormones and, is crabby on their own or, is difficult to start with, maybe, I don't know. And then to try to discern what is normal for, a teenager and then what is obviously not normal. And I think that's a real challenge for a lot of parents.
It is. It is
Yeah.
definitely a challenging time. I think trying to keep lines of communication open can be helpful. I think checking on phones and tablets for online discussions can sometimes be helpful, where you find clues. And I think knowing what to look for. So in terms of the behavioral signs, knowing what the devices look like, because some of these are designed to look like other things, designed to be hidden
Like
in
a
plain view.
USB and,
Yeah, which
all of that kind of stuff.
I think is really terrifying, even for myself who's in the field, because they keep changing. But I remember seeing something online where they had a picture of a child's desk, and it looked like the child was just doing homework, and they wanted you to count up how many vaping devices were on the desk, hidden as the USB drives or little calculators or other things, and I think that's really challenging.
And they even have the hoodie that has the drawstring on it. You suck in one and blow out the other, whatever. I mean, think of this, what they're doing to our kids on purpose for the almighty dollar. It's very disheartening. And I think in most instances kind of evil that they're doing this and that the kids don't know. I mean, kids can hardly just be kids anymore. It's so difficult. I say this about every podcast I do. I think that the kids can't experiment with anything that's even a little bit, like I said, somebody goes out and they try a cigarette. Okay. Well, once you start doing the vaping, it kind of can get a hold of you pretty quick. Way more so, I think, than a casual cigarette, although I didn't smoke either. But I'm just saying, I just think and I know that some of the things that it does is reduces their attention span. Oh, brother, that's all they need is a reduced attention span at school. The teachers are fighting tooth and nail to make sure that they're getting the information to them. Right. So, and then impulsivity. Like, what teenager needs to be more impulsive? Come on, and then we talked about the anxiety and stuff. But the one thing I read that I thought was interesting, you might comment on, is the depressive symptoms that can happen after a young person is vaped for a long time, and now they're an older adult, that a lot of depression can come along with that. Have you witnessed anything like that?
I certainly have. I think the hard part is sometimes figuring out cause and effect. So how much of it is the effects of nicotine and other substances triggering the depression. And very often we know that it takes the brain sometimes a year, 18 months after stopping a substance for it to look normal again on functional MRI or other testing strategies. So it can be a long time after stopping something before we sort of see that health return. I think we also are recognizing for our kids and adolescents, so very often they're using because of social pressures, but another one of the big reasons that they say that they are using is depression, anxiety, and stress kind of preceding the substance use. That, they're worried, concerns maybe about family members, maybe childhood traumatic events, all of these things, maybe the craziness that is social media. And so sometimes what they're doing is actually self-treating with the nicotine or the alcohol. They don't like the way they're feeling. They may not have healthy coping strategies or a good support system. And so then they may turn to substances to self-treat some of those negative feelings. And so I think sometimes it gets into this chicken or the egg, which came first.
Right.
But we know that yes, nicotine can cause it, and nicotine can perpetuate it, kind of continue that, because it is hard for the brain to recover under the influence of substances.
Well, and you brought up about a good support system and getting back to the ACEs, the adolescent traumas that can happen. You think about major things like sexual abuse or physical abuse at home, that type of thing. But honestly, there's so many other things that are still considered to be traumas that these kids are carrying to school or carrying with them, a parent's divorce and the shouting going on at the house, or maybe grandma is very sick and is dying. And I mean, there's so many things that you wouldn't put in that category of traumatic, but they are. For a kid, that's traumatic.
Absolutely.
Yeah.
Absolutely. And I was struck when I worked at some sober living houses when I was doing primary care. I could pretty much guarantee that my female patients coming from sober living would have something traumatic in their history. I quite honestly just assumed that either physical abuse or sexual assault or domestic violence would be checked on our questionnaire, because I almost never saw somebody in that setting without past trauma driving it.
Right. And those kind of traumatic things that happen, they might benefit, obviously, hopefully benefit from therapy and things like that. But the shame of it and the anxiety that goes along with not even just the sexual abuse, but I mean just all of it, they carry with them, and it keeps bringing it back up again. I talked to, when Mary Wolf was on, we talked about that a little bit about, and can result in some serious things. So it is, are they medicating themselves to feel better? And I think you're 100% right that is what they're doing. It might not have started that way. It might started just, somebody had this, and like you said, it's a social pressure. Now all of your friends, that you've hung out with for the last 2 or 3 years are now doing this, and you don't want to do it. Well, then do you find other friends? It's so hard for them to not be pressured in some ways into at least trying some things. And it obviously doesn't work out very well. And some of them can pick it up and some of them cannot, but that's a heck of a thing for a kid.
It is. It really is.
It really is. Well, the other thing that I read was that with this increase of the nicotine, and I never thought about this, that I knew use of other drugs is, a thing that can go on as a pathway sort of thing. I know THC for sure is too, but I didn't really know risky sexual behavior was in that group either. Have you had any experience with that anything that you've noticed?
I think that is something that we will commonly see. Sometimes I think of it more intertwined with alcohol, lots of risky choices with that. But I think when it comes to nicotine and vaping, it's certainly affecting kind of that reward center, as you said, increases impulsivity. And I think when an individual vapes, especially if they recognize that their parents or their peers disapprove, they've already kind of crossed one line to go into vaping. And I think sometimes once you've crossed one line and maybe gotten away with it, nobody's, called you out, you haven't gotten in trouble at school. Sometimes I think it's a little easier to continue to push those lines of things. So I think part of it may be, kind of related to some of that reward brain chemistry, but I think part of it is also whether a toddler or a teenager, you're going to push limits. And so if you push a limit and you get through, that may make you continue to push some more, sort of some more limits for things. And I also think that sometimes the teens and adolescents who are engaging some of those risky behaviors are maybe not as well supervised. Maybe
True.
have one parent family, parents working a lot, maybe other stressors going on. And so I also wonder if that's at least part of that story, part of that puzzle.
So I guess the bottom line really is all parents are not created equal. All parents are not as aware as one might be very aware of this kind of stuff, might not be, but talking to each other and communicating, gee, I'm kind of nervous about, Joey's been coming home and what, but unfortunately there is a stigma about all of this that parents want to appear they got it all together. We got it together and everything's going great and whatever. So they don't want to ever let their guard down. And I feel that's the terrible mistake that parents do. I mean, I probably was one of them too, that you just don't want to think that, Susie's doing such and such. But if they talk to each other and of course, shared talking to the kids, that would make all the difference in the world, because there are ways of talking to the kids. And I have a little intro on my thing that says, don't sit down and have a talk at the kitchen table. That's stressful, but you can talk to them constantly. Well, I don't mean constantly, but intermittently with a one line or whatever. What do you think about that? Those open-ended questions, and then when they say something to you, you repeat it back what you think they said and see if that was even right.
Yeah. Yeah, no, I think having that line of communication is key. I think reassuring them that you want to be a safe person, that if they need to be picked up from a party, that you will do it, that you won't scold them, that, you want them to be, sort of safe and sound. And I think this is one place where social media can actually be helpful, looking up podcasts, or I know Cincinnati Children's just had something that was showing up on Facebook where they talked about reducing the stigma about seeking counseling for your child. It does not mean you're a failure. It means you and your child are going through a difficult time. You need some extra help. You need some extra support. We would think twice about, taking the child to the pediatrician if they had a sore throat or a bad knee or some other issue. And I'm really hoping that this next generation is more comfortable talking about mental health. And as you said, that it won't be a scary sit down conversation, but just talking often when they're in the car and they aren't necessarily looking at you can be easy when you're working around the yard, and just trying to sometimes keep it open-ended, and sometimes asking what friends are doing, because some kids are very willing to open up. And usually the kids know what's happening in their school and areas of concern. They know.
Oh, yes, they do. They know a lot of that. And I think the more that open you can be about validating what they're going through. We all know middle school and high school is not that easy. And, they've got pressures from internal pressures externally, school and exams and that type of thing. And then we add all this social media stuff, with Instagram and all the things that they Snapchat and TikTok and all that. And they have a perception of themselves to be being perfect. And then when they don't think they measure up, sometimes then they pick some of these things that are such a health risk and can affect their entire future. And that's, I think, what's the scariest part. It's not that just like picking it up and putting it down or whatever, but when you actually have to get help for this, like you said, talking to somebody objective. Your mom's not objective. Your dad's not objective, but a therapist can certainly be objective and help you through it. But they have, and I'm going to put it up with this podcast, some of the different websites and stuff that you can get on for, the Truth Initiative has a great program for trying to get off of it. And it can happen. Kids do get off of this stuff and realize that they can take back their life. And, with athletes particularly that are trying to run up and down the football field and they're doing this, well, we know that's not working out very well. So if they want that life back, there are some things out there that they can do that I think, parents would offer that to them if it's important enough to them, if they haven't crossed that barrier that you talked about where they don't care about anything. And that's That's the really frightening part to me, because just reeling them back from that is very hard, I think.
Very hard.
Harder
Well,
than we would even think.
I think also, as you mentioned, the point of no return from health consequences. Normally we are thinking of, deadly things being alcohol and driving under the influence or accidentally being exposed to fentanyl, but we know vaping can kill.
Yes.
I think reading the studies and the information about e-valley, so that is the new terminology for e-cigarette or vaping product use associated lung injury. There was a huge spurt of these back in 2019 into 2020, where approximately 3,000 cases were reported to the CDC of typically young men developing severe lung problems and issues. And unfortunately, just in that short reporting period, there were about 70 deaths. And that is just terrifying, of these young, healthy people with really no previous medical history, or some had mild asthma as a pre-existing condition, and they go to the hospital, usually are pretty sick. About half of individuals had low oxygen levels upon presentation. About a quarter of them needed ventilatory support, which is just terrifying. And we think that part of that outbreak was related to vitamin E and THC vapes, because it did seem to get a little better, but we are still seeing vape-related lung injuries, on a regular basis. And the hard part is it's a diagnosis of exclusion. So you pretty much have to rule out everything else, make sure it's not asthma or COVID or a regular form of pneumonia, and we still don't have specific treatments. We'll try steroids, we'll try antibiotics in case there is a bacterial infection we're missing. But these kids can be really, really sick, and many of them, as you mentioned, may go on to needing lung transplants or other medical care down the road. And we don't know why some people have it and some people don't. We don't know why young men are more affected than young women. But it's definitely something scary to think about, that something so life-changing, so serious can be from using what is touted as a healthier alternative to cigarettes.
Right. And people that started smoking when they were maybe not 5, but like say 16 or whatever, there was a much longer years and years of damage, but it was slower than this. This is way more accelerated because of the high potency of the nicotine. And so that's why, to say don't smoke cigarettes when I was young, made sense, of course, and it still makes sense. But the urgency of this vaping is paramount because of how quickly they can become so affected.
Right.
I know. Well,
I have a feeling we're missing at least some of these cases, because, I think once we stopped just sort of tracking it, then it's much harder to know how often is this occurring. We know it's still occurring, but just in terms of the frequency and trying to figure out what other new additives or new flavoring agents or other things may cause another outbreak like this.
Right. Well, 2 of the things that I read that could help for the community wise, obviously for school, more drug prevention coalitions in the schools would make a huge difference. But some schools do, some schools don't. But for the community end of it, limiting having the local authorities like trustees or whatever. Trustees don't always have a lot of teeth. I mean, and they can do some stuff, but not, it's not like the sheriff. But they can do some stuff, but to limit the flavors, so let's say in Anderson Township, they would vote that we will not allow the sale of, certain flavors. Now that would be a tough one because you got businesses that would be, what are you talking about? But that would be one thing. And then also everything's about money to place additional taxes, big taxes on vape shops in the township that, that if they're going to operate there, and particularly when they're selling to our kids, that they're going to pay a financial fine for that, because like you said earlier, it's a slap on the wrist. And, and plus you have to catch them, you have to, you have to have somebody that looks like a teenager go in there and try to buy. And then, but it's an ongoing constant thing. And I know I walked into one of the, I won't mention which one it is. I'd love to, but I walked in to see if they were not to sell to me. I don't mean that, but to see what they had for signage in there. And they didn't have what they should have had. And I'm sure they're looking at, look at this old lady. What's she doing in here? But I wanted to see if they had a thing about you had to be 21 to purchase it and that type of thing. And it is just an uphill battle. Well, I know we're coming up against a hard stop here in a minute, but Amy, thank you so much for being on and sharing what you see on your end. And I hope together we can just wake parents up that this is out there and that they are the chief influencer of their own child for the most part. They really are, and they can influence them. So I don't know. Do you have any other ideas we can tell them?
Well, I think certainly talking to our elected officials, as you stated, talking to our school officials to make sure that they know that they have our support as well. And I think one of the other questions is for some of these big groupings really trying to bring light to some of the other illegal activities. Right now, VIP smoke shops is under federal investigation for money laundering, sex trafficking, a whole bunch of other things. And so I think the more that different government entities and get involved, I think that may be someplace where we have teeth. And I would say that we are making a difference. Kelsey Smothers and Coalition for Drug-Free Claremont County is definitely out there talking to our kids, each and every day, trying to do some of these sting operations to see if they can catch folks in the act. So we are beginning to see some progress in the teens, and I hope it translates soon into the 20-year-olds because they're kind of our next frontier, I think.
I agree. All we can do is what we can do and then keep praying that it gets changed. So, well, thank you so much, Amy, for being on today.
So nice to meet you.
I appreciate it. I really do. We just keep trying to come up with more and more podcasts that, are addressing the things that really are affecting parents. And I think we've covered vaping for the most part and some of the changes that have occurred since 2018 when I first started doing this. So I really appreciate it. So to the audience, thank you. Yep. Thank you, Amy. Thank you all for listening today. I appreciate it. We are hoping and praying that parents wake up and listen to what is out there. And Amy did a wonderful, amazing job on the vape culture. You can see these podcasts on YouTube, social media, including Facebook, Instagram, X, and LinkedIn. You can also access them on our website, which is www.stepupanderson.org, and also listen to them on Spotify. But please share, subscribe, and follow us so that we can reach more parents and get the funding we need to continue. So thank you so much and have a good evening.